Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Monday, September 15th. Today on HITshow, a $50 billion federal push to transform rural health, new warnings as clinic closures accelerate. And women's health startup Diana raises $55 million to expand. Plus, nurses step up with innovations to reduce burnout. Exact Sciences rolls out a multi-cancer blood test and will end with a bright spot in pediatric mental health. Let's get started. Anika, Washington just announced a huge new program for rural healthcare. What's on the table?
CMS is rolling out the Rural Health Transformation Program RHONDA. $50 billion are budgeted over the next 5 years to stabilize and modernize rural healthcare. States can apply for funds to keep hospitals open, expand workforce, upgrade technology, and test new care models. But here's the wrinkle. Every state only gets one shot at applying, and the deadline is in early November. That's a really tight timeline to pull together a plan that covers everything from staffing shortages to digital infrastructure.
So if you're a rural hospital leader, what should you be doing right now?
First, confirm that your state is actually applying. Not every state will. Second, get your house in order. Financials, staffing gaps, patient volumes, and tech needs. That's the evidence state agencies need to make a compelling case.
Sounds like it's both a big opportunity and a scramble.
Exactly. And because of that pressure, some are already calling it a rural health Hunger Games.
We'll keep watching that closely. And Anika, that Hunger Games description isn't just colorful language. We're already seeing the stakes play out on the ground. Teresa Vaughn joins us now with more. Teresa, what's happening in these rural communities?
RHONDA, more and more rural clinics are closing their doors, and not just tiny practices. We're talking about primary care hubs that served as the only point of entry into the healthcare system for entire counties. When they shut down, patients aren't just inconvenienced. They're forced to travel hours for basic services like checkups, lab work, or prenatal care. The timing is what's striking. As states scramble to prepare their applications for the new $50 billion federal fund, many local leaders say they're operating in survival mode. They don't have the staff, the infrastructure, or the financial cushion to wait months for relief. And with the application window so short, there's a real fear that states with more resources will capture the bulk of funding, leaving these already struggling communities behind.
So what are they doing in the meantime?
Some hospitals are pooling resources, sharing specialists, creating joint purchasing agreements, or relying on mobile clinics. But it's a patchwork solution. For families in these towns, it often means delayed care, higher costs, and worsening outcomes.
Thanks for the detailed look at this troubling situation, Teresa.
The stakes certainly are high. Thank you, RHONDA.
We'll take a quick break. Still ahead, a big fundraise in women's health, nurses are rethinking technology to ease burnout, and Exact Sciences launches a new cancer blood test. We'll close on a bright spot, a partnership bringing new mental health support to kids and families. Stay with us.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
Welcome back. You're listening to HITshow Daily. Logan, we've been talking a lot about public funding today, but there's also private money flowing into women's health. What can you tell us?
That's right, Rhonda. Diana Health just raised $55 million to expand its hybrid care model for women. The company operates physical clinics alongside digital platforms, offering services that range from maternity care to broader women's health needs. What makes their model stand out is the continuity. Patients can move seamlessly from in-person visits to digital support between appointments. Investors see it as a blueprint for value-based women's care, especially in communities that often don't have enough dedicated providers.
So, where does this new round of funding go?
It's earmarked for opening more clinics, scaling the digital side of the platform, and strengthening clinical programs. Essentially, it's about reaching more women and building depth into the services they already provide.
Thank you, Logan. While Diana Health is using fresh funding to reimagine women's care inside hospitals and clinics, nurses are driving innovation of their own. Nate Collier has been looking at how frontline staff are turning technology into a tool for better care and less burnout. Sometimes innovation develops closest to the bedside. Nate, what are you seeing?
RHONDA, we're seeing nurses are stepping into the role of innovators in a big way. At several health systems, they're designing tools to cut back on the daily grind. Things like smart scheduling apps, decision support dashboards, and streamlined communication platforms. These aren't vendor products being handed down. They're solutions dreamed up by bedside nurses who know exactly where the pain points are. And the payoff is real: less burnout, smoother workflows, and more time for direct patient care. In some pilot projects, nurses report saving hours each week just by automating routine tasks.
Are hospitals backing these grassroots projects?
They are. More organizations are carving out seed funding to test nurse-built ideas. It's a shift in mindset. Instead of waiting for outside tech vendors, they're investing in their own staff's creativity. And it turns out those small, practical innovations can have a big impact on both retention and patient satisfaction.
Just goes to show, the people delivering care often have the best ideas for improving it. Thanks, Nate. Jade, there's a new blood test making headlines this week. What is Exact Sciences bringing to market?
RHONDA, Exact Sciences has launched CancerGuard, a blood-based test designed to detect more than 50 different cancers at an early stage. It's what's known as a multi-cancer early detection test, or MCED, and it's priced around $690. What sets CancerGuard apart is its broad panel. It looks for dozens of tumor types, not just a single cancer. In clinical trials, it showed the ability to pick up cancers like pancreatic, ovarian, and liver, which are often missed until late stages. The company is now working with payers on coverage decisions, but Exact says they see CancerGuard as a complement to existing screenings like mammograms or colonoscopies, not a replacement. Analysts project the MCED market could be worth tens of billions annually if insurers adopt reimbursement policies, making this launch a major moment in the diagnostic space.
So it could be a game changer, but it'll hinge on whether payers step up.
Exactly. Without coverage, access could be limited to those who can pay out of pocket, which is why the reimbursement conversation is so critical right now.
We'll keep an eye on that. Thanks, Jade. We'll close today with a bright spot. Jalen, I hear there is encouraging news in pediatric mental health care.
That's right, Rhonda. Northwell Health has partnered with Brightline to expand pediatric mental health services across New York. The goal is to make it easier for families to get help, cutting referral delays, offering both in-person and virtual care, and creating a smoother path into behavior. Demand for child and adolescent mental health has exploded, and traditional systems just haven't kept up. By combining Northwell's scale with Brightline's tech-enabled platform, this partnership could reach thousands of families who might otherwise wait months for care.
And Jalen, could this serve as a model outside New York?
It absolutely could. If the approach proves successful, leaders say it's designed to scale nationwide, giving other health systems a roadmap for blending digital and traditional care.
Congratulations to Northwell for taking a leadership role here. We'll look forward to reporting on the positive outcomes this partnership delivers. Thanks, Jalen. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, kimchi.com.